Hi, this is Jeff Vogan with another edition of Ask Jeff Vogan. This week's question came from a lady who is single. She's retired and she has limited funds and she's wondering about long-term care insurance or a plan. Now, boy, there's a lot of options for long-term care planning. Unfortunately, the majority of people end up paying for long-term care out of pocket. Long-term care meaning when you're disabled, can't function on your own, you need that full-time care. Now, long-term care could happen in your home, could also happen in a long-term care facility, and we know those facilities can be very expensive. If you can afford $7, $8, $9, or $10,000 a month, that's in today's dollars, then hey, you're good to go. But most people can't afford that, at least not for a very long period of time. So what are the options? Well, some of the options, if you have good cash flow but not a lot of savings, you may want to just buy a pay-as-you-go long-term care insurance program. Now, the unfortunate part about long-term care insurance pay-as-you-go plans is they seem to keep going up. After a few years, you might have a 20 or 30% rate hike just to make sure that the companies who are now having to pay long-term care bills for people who are living longer and longer and living through things that we used to die from, unfortunately, you have to raise the rates. I get that. The companies have to stay in business. But you may not like how that deals with your budget. Now, there are some alternatives with what's called single premium or single pay long-term care, where if you have, let's say, $50,000 or $100,000, you could set it off the side in a long-term care bucket that should you go to a long-term care facility, depending on your age and your health when you get it, you may have 3 or 4 or 5 times that amount, maybe a couple $100,000 or more, kind of in a bucket to use for long-term care. And here's the best part. If somehow you need that money, that, let's say, $100,000 or $50,000 that you set aside, and you just have to have it, you can get that money back and you can use it and spend it for something you need in retirement. Now, the caveat to that, obviously, is you lose the insurance portion. However, if you die before you go to a nursing home, or if you die while you're in a nursing home, if you have not spent that increased larger amount of money set aside for your long-term care, you actually get that sent or spent or passed on to your heirs. So there are some single premium or some alternatives to the pay-as-you-go life insurance or the long-term care insurance that may work better than the pay-as-you-go where you get to an age where you just can't afford it anymore. That would be kind of a losing situation. So if you have any questions about long-term care alternatives, rather than just paying for it on your own, feel free to give us a call or send us a message. We'd be happy to help.